Hi, my name is Mackenzie. I'm a medical assistant. I'm 23, and I work here at the Dermatology and Laser Center of Chapel Hill.
All right, Mackenzie. And how long have you struggled with acne?
Yeah, so I actually survived high school without acne, which was a blessing. But then I got adult acne at 22, and I got it pretty severe, so it kind of came out of nowhere.
And what were some of the treatments or things that you did prior to starting your Accutane journey?
Yeah, so I actually did see a dermatologist in my hometown, probably about like my freshman year of college, because I got the occasional pimple and I just wanted to see what could be done about it. She put me on a prescription retinoid, which I think is a great option for anybody, acne or not. So I tried that for a few years, but then again, when I turned 22, something just flipped and I got all of this cystic, deep acne. It was not controlled with the topical retinoid, and that's when I knew it was time to try something more aggressive, a more aggressive treatment. And actually, luckily for me, it was when I was already working here. So I worked hand in hand with our providers, and I tried antibiotics and I tried other topicals, and nothing was really doing the trick. So I eventually decided to jump on the Accutane boat, and that is what I'm currently doing.
And what has your Accutane journey been like? How many months have you been on it now?
Yeah, so I'm still new in my Accutane journey. I started 2 months ago. I'm on my second month right now. I started at, our providers are really good at gradually working our way up. So I started at 30 milligrams, it was very tolerable, and it kind of got me in the routine. And then the second month, I'm on 40 milligrams, and I just take it once a day. And I have like a whole little Accutane routine, and it's been very manageable. It's great that I work with the providers, but even when you don't, they're so good about making sure that you can manage all the side effects and that you kind of have a solid routine and you have a lot of tricks up your sleeve in case you were to have any side effects and kind of how to deal with them. So it's been going really well.
Have you experienced any side effects so far?
Yeah, I have. They've been very manageable. Definitely some dryness. Dryness of mucosal membranes is expected. So I've had a little bit of some dry eye, but nothing that some eye drops can't fix. A little bit of a dry nose, but nothing some Aquaphor can't fix, or some saline nasal spray. A little trick that I do is I sleep with a humidifier on. I feel like it just kind of keeps the air in my room, humidified, which really helps. And then I've had a little bit of dryness of the hands, which really goes hand in hand. I'm washing my hands all the time here, but nothing that some lotion or some steroid can't fix. So a few, but they've all been very manageable.
And there was something interesting that happened for you, particularly prior to starting Accutane, that kind of changed things. Can you talk about that a little bit?
Yeah, of course. So I think this kind of goes hand in hand with the, random acne breakout at 22, but I have always had crazy big tonsils and I always got tonsillitis and I was always sick. And this past year, this became something that I could no longer deal with. The tonsillitis just became to be too much, the strep. So I actually met with a surgeon and I got my tonsils removed. And the day I got my tonsils removed, I mean, there's a picture of me in the pre-op room and I have so much acne. It's so cystic and deep and painful. And then as I'm just 2 weeks at home recovering, my acne gets so much better. And so I think my tonsils were chronically inflamed, and this was contributing to just widespread inflammation, which really contributed to my acne. I'm still doing Accutane to help because I've got some post-inflammatory hyperpigmentation and some scarring, but it really wasn't until I got my tonsils removed that my big acne, cystic, deep breakouts started to resolve a little on their own. So I find that very interesting. I feel like you don't really hear that a lot, but I really think my tonsils are a contributing factor to my acne.
So, what would you say has been your experience with your skincare routine and how that has changed with Accutane?
Yeah, the great thing is it hasn't needed to change much. I mean, before I was using a wash with like an active ingredient in it, which the Accutane is my active ingredient right now. So all I do is take that once a day. I take it with a fish oil supplement to kind of help mitigate side effects. But then I wash my face with a gentle cleanser twice a day. I use a moisturizer. You want to be really diligent with your moisturizing. So right when I get out of the shower, I put on a thin moisturizer, and then before I go to bed, I put a thick moisturizer on. If I've had a really rough day in the sun and I'm kind of sunburnt, which I don't recommend, but it does happen, it's inevitable, I use like a really, really thick moisturizer. But I just do that a lot, and that's really it. And then sunscreen daily, always. Can't recommend that enough.
So, what would be your advice to somebody who is maybe interested in Accutane, but maybe feeling a little apprehensive about getting started?
Yeah, well, I just knew it was time for me to do something serious about my acne, because I would wake up in the morning and I'd be scared to look in the mirror to see how many new pimples I had. So I knew when it reached that point that I no longer wanted to live with that fear. And that's when I started working with our dermatologist here, and I got put on Accutane. And that would be my advice for anybody, is just go meet with a dermatologist, listen to them and see their recommendations. There's a lot of misinformation about Accutane, and it can seem kind of daunting, but it really does. It does great things for your skin, and you work hand in hand with a dermatologist, and they'll really help you manage all side effects if you were to have any. But I've seen it do great things for our patients. It's doing great things for me, and I couldn't recommend it enough. Go meet with a dermatologist and get your questions answered, and they'll work with you to get your acne managed.
How did having such severe acne kind of affect your overall quality of life?
Yeah, it was hard, especially, being in high school and not ever having acne, and then having it at 22 when I thought I was in the clear. I really felt like I couldn't go anywhere without wearing makeup, and there's this internalized burden of like having other people look at me. I feel like I don't want them to see what, I mean, I look in the mirror and it's unfortunate, but I feel like this guilt when other people see and they look at, I'm just covered in pimples, and I don't know, I just always covered up in makeup, and I always covered them, and I knew it was really bad, and I knew I really needed some help, and I'd wake up in the morning and I'd be afraid to look in the mirror because I knew I would have new pimples. I just didn't want to know how many. So that's when I knew I really needed help, and it really did take a toll on my mental health, but once I got the right help, it all got better.